So there's a lot to talk about yet again. I think it's fair to say the world is imploding and the economy is imploding. And this pandemic that we're witnessing is as real as a heart attack. It's as real as it gets. So let me give you an update on that. And, I don't know how much this helps you guys in terms of assuaging your fears, but I'll do my best to be the information man in these trying times. So these numbers here are as of last night, and there's a big caveat that I need to add as we talk about these numbers, which is this represents the official cases. The official cases of the coronavirus, or, as it's now being called because it's more accurate and specific, the COVID-19 virus. So you can see total cases in the world as of last night, 164,167. Now, later on in the night, it already had gotten up to 170,000. Today, I'm sure it's way above that. I'm sure it's way above 170,000. And again, this is official cases, and there's an asterisk near this. So they say deaths, 6,473. Recovered, 75,911. Unresolved, 81,783. And you can see in the list of countries there, you have China had the most cases and the most deaths, but of course the outbreak, happened there first. So it would make sense that they're just, ahead of us in how many cases they have. But other countries are going to catch up. After China, Italy was the next one that was hit hardest. But again, another asterisk here is it's just because it got there first. It got there before it got to the U.S. So it's not like, their numbers are bad and they will remain the worst. No, when all is said and done, this is all subject to change. Iran is also getting hammered. Official cases, 13,938. Deaths, 724. South Korea, 8,162. Deaths, 75. Now, certain countries are actually handling this amazingly, and others are not. So let me tell you, I'll tell you now because I feel like it's so important that this is nowhere near the actual representation of how many cases are out there. This is subject to how many tests does each respective country have? How many people are they testing? How many people are showing up, to the emergency room, to the hospital with symptoms? How many are not? So the United States, as you can see, is 3,621 cases official right now, 63 deaths, 60 in critical condition, 60 in serious condition, 4 in critical condition, 9 recovered. So we don't have any tests here. We have very few tests, and we don't have the test that's done and then you get the information quickly. We have an inferior system in many respects. I'll just say it. It's an inferior system. In South Korea, they have the immediate test, and you can literally go, there's like a drive-through testing center, or many of them all around the country. Here, I believe in 2 places we have a drive-through testing center. One of them, funny enough, is my hometown, New Rochelle, New York. They have a drive-through testing thing there, but that's not thanks to Trump. That's thanks to Andrew Cuomo. And then there's another one, I believe, in Washington State. These were 2 places that were hit pretty hard. But at least as of right now, we don't have that many drive-through centers. We need them. We need the quick test. I have a buddy of mine is a doctor in New York City. He's been updating me with everything that's going on. They've stopped all elective procedures, and they've said they're only treating people for COVID-19 now. And they, even in the city, they don't have the quick test. Their test takes 72 hours. And that's complicating the situation a lot more. Because if you could test somebody and find out they don't have COVID-19, then, you can release them. They can go home and not clog up the system. And already we're at the point where our system is overburdened. We're already at that point. And so it's only going to get worse and worse and worse. And right now, you're starting to see some very restrictive measures being taken. But honestly, it's too late. It's too late. What we needed to do, in all seriousness, is go into lockdown mode, quarantine mode, in like March 5th, March 4th, right around there. And then we really would have what they call flatten the curve, which is make it so that even though the cases will continue to come in, it'll be enough and spread out enough where our hospital system can handle the patients. When you let a pandemic get out of control like this one is, it's going to quickly overburden the system, and then a lot more people won't get the care that they need, and a lot more people will die. So the countries that have handled this well, Taiwan handled it amazingly. Singapore handled it amazingly. South Korea, even though they had a decent number of cases, they're handling it very well. It was literally one person who got around the original quarantine, which then led to the outbreak numbers being as high as it is. I believe he got like an entire church congregation sick with it. But, now they're on the rebound. And the way that they've handled this, well, first of all, they've had previous outbreaks, and so they were prepared. They stocked up on the tests. They stocked up on the ventilators. They have way more ICU beds per capita than we do. They have, the provisions in place to just like press a button, shut down the whole system, and let everybody know, like, this is what we're doing for the next month. And they're able to defeat the virus in a relatively quick fashion, and because they've been through similar things before. Whereas here, of course, we have a president who cut funding for the CDC and Health and Human Services and literally fired the pandemic experts in 2018. I wish I was wrong about that. I wish I was lying about that. I'm not. Donald Trump and his administration, I believe John Bolton was the one who specifically did it. They let go pandemic experts. And those guys warned on the way out the door, bad move. And now here we are. They're scrambling in real time. And of course, they're way behind what they should be doing, and the results are disastrous, and they're going to get worse and worse and worse. So our reaction is going to be a hell of a lot more like Iran, a hell of a lot more like Italy, where they didn't act quick enough, they didn't act swiftly enough, and the cases are going to skyrocket. And again, the official number of 3,621 cases in the U.S. as of last night, way off base. Way off base. It's at least 10 times more than that. I would say probably more, because we do have a shortage of tests in this country. And I know, I see it myself on Twitter. People I know have it, and they're staying inside because they're like, hey, if we don't have the tests, I'm not going to go out. I'm just going to stay in, drink fluids, stay away from everybody, quarantine myself. So, yeah, this is a genuine crisis that we have here. Now, I don't want to scare people further, except that's exactly what I'm going to end up doing. Look at what Australian State News is reporting. Chinese doctors say coronavirus is like a combination of SARS and AIDS and can cause irreversible lung damage. Chinese doctors say autopsies of coronavirus patients suggest the deadly illness is like a combination of SARS and AIDS that can cause irreversible lung damage. So the reporting now is indicating that there's these wet markets in China, which is just a fancy way of saying there's these markets where you have all these exotic animals, all this exotic meat, and literally animals from Africa and South America and all around the world. And they're living in close quarters in cages on top of each other. And then you have, all the animals like basically pissing and shitting on each other. And they slaughter the animal in real time if somebody wants meat from a certain animal. And it's suspected that this was from bats. So this was transmitted to a human from bats, and it had something to do, they think, with blood. So who knows exactly how it went down. Just little droplets getting in one of somebody's orifices, weird word, or maybe cutting themselves and then the bat blood getting in there, something along those lines, and then we're off to the races. Now, this sickness gets transmitted in the same way that the flu gets transmitted, influenza. So when you cough, when you sneeze, there's like tiny droplets that get in the air, and then if they happen to get in your body somehow, if you shake somebody's hand, for example, and then you touch your face, you touch your eye, whatever it might be, that's how you get infected. So it's really easy to spread this, which also makes it difficult. And we have humans haven't developed an immunity to this yet because this is new. And that alone makes it so much more dangerous because a lot of people are comparing it to the flu, full stop. No, we've developed an immunity to the flu, or many people have, and so the flu needs to get crafty, and it can only infect people, during the perfect time of year, during flu season. This is not like that. Most experts are saying that this is not just going to die out with the warmer weather because we haven't developed an immunity to it, so it could just keep spreading. Now, in terms of how deadly it is, it's anywhere from 10 times to 30 times as deadly as the flu. So if there's a 0.1% death rate, they say it's about a 3% death rate for this. Now, those numbers are, subject to go up, it's subject to go down. They do change a little bit the more information that we get, of course. And it certainly has devastating effects. They say, mostly the people who get impacted by it are older folks or folks with a compromised immune system or obesity, some underlying problem. But that's not the only people who get impacted by it, because you also have, and I know because, my buddy's a doctor in New York City. He's telling me that healthy 33-year-old came in, had to be intubated. He couldn't breathe alone because the virus was destroying his respiratory system. Healthy 24-year-old, no underlying conditions. Same thing, had to be intubated. So it's also impacting young folks. And it affects different people in different ways. There's a lot of talk of some people get it and they're totally asymptomatic, but it doesn't matter because they could still spread it to other people who will be symptomatic. And so that's one of the reasons why this is so dangerous, is that it takes a little bit for the symptoms to show up, but you're still able to spread it even when you don't have the symptoms. So that's why, one of the main reasons why they have to shut everything down, because you could be out there, like Walt Disney World was open last night. People were out there. Even if you're not showing symptoms, you could have it, and you could be transferring it to somebody who could die from it. So it's a very, very serious thing. And we are going to get to exactly what's happening in a little bit in terms of the economy and the government measures that are, being taken, because this is unlike anything. I'm 32. It's unlike anything I've ever experienced in my lifetime. And, I just had a conversation with somebody who's in his 70s, and he said, this is unlike anything I've ever experienced either. So we're in uncharted territory here. Now, the next question is, how bad will this get? How bad will this get? Well, Business Insider reports the following. A panel of experts at the University of California, San Francisco, predicted that between 40 and 70% of Americans could become infected within the next 18 months. One internist attending the panel said, assuming a 1% mortality rate from the coronavirus and 50% of the U.S. population becoming infected, that means about 1.5 million Americans could die. That's if no drug is found effective and made available. Accordingly, the panelists suggested anyone over 60 stay at home unless it's critical. In February, disease modelers from the CDC suggested between 160 million and 214 million Americans could be infected, and as many as 1.7 million could die. So this is bad. And, a vaccine would help massively. Outside of a vaccine, our only option is basically to lock down the country, quarantine the country, and do it for as long as we need to do it. But that has other consequences that are, of course, very dire as well. But the crazy thing is, even with them working on a vaccine, it's still a long way away. No matter what we do, it's a long way away. So like I said, this is unprecedented. This is a pandemic. This is exactly like the kind of stuff you see in movies. I mean, you could say maybe it's a little bit different because in the movies, usually the premise is we have a disease that has like a 50% death rate or a 70% death rate, more similar to Ebola. But the thing about Ebola is it doesn't spread as easily as coronavirus spreads. And to have something spread this easily and have a death rate that's 10 to 30 times higher than the flu, that is a genuine pandemic. And so, again, later on, I'm going to do it in a separate segment. This segment, I just want it to be about the virus itself. But I will get to what governments are doing. I will get to what's happening with the economy. But my advice to everybody watching this is what I'm doing myself, which is Don't go outside unless you absolutely have to. You know, I will predict that very soon, either on a state-by-state basis or nationally, they are going to do a lockdown, and they're going to say the only places you can go are to the pharmacy, to the grocery store, or to the hospital. That's it. It's very possible that that gets rolled out soon. Because again, really the only way to fight back against this, the only way to flatten that curve is to have basically a mandatory lockdown, mandatory quarantine. And even with doing that, we still probably will overburden our healthcare system because we're doing it too little too late. And if you look at what happened in northern Italy, that's what's coming here next. And what happened in northern Italy, if you read the firsthand accounts of the doctors and the nurses who were dealing with the overflow of patients, it's a nightmare. It is like something out of a horror movie. Having to determine, hey, who gets a ventilator because we don't have enough ventilators. So, sorry, if you're 85 and you have an underlying pre-existing condition, you're done. There's nothing we could do for you. I guess we got to go to the 73-year-old. But, oh, look at that. Somebody just walked in and they need a ventilator, and they're 66. So maybe the 73-year-old has to die, too. They're making life and death decisions. And, you know, what this shows is we need a national healthcare system, of course, and we need preparedness for stuff like this. We spent 1.5% of our military budget is spent on the CDC and this kind of pandemic disaster preparedness. Less than that, even. So the fact that we have fewer hospital beds than South Korea, we have fewer hospital beds and ICU beds than every other developed country. And now we're seeing the chickens coming home to roost on that. This is where we should put our money. We shouldn't have to... There's a shortage of the masks, of the basic masks that these doctors need to keep working. I mean, think about that, man. We're getting an emergency delivery of it from China. We're totally dependent on China for a lot of the supplies and goods and medicines that we need. This is insanity. This should really wake people up and make them rethink this. And make us go, oh, okay, so maybe we need way more ventilators, way more masks, way more hospital beds, a national healthcare system. Right now they're saying only the testing is free, not the treatment. Only the testing is free. And even with that, it's not complete because some people are getting charged even for just the tests. And again, we have a shortage of the tests. So we were totally caught off guard. We haven't had a real terrifying pandemic hit here since the 1918 Spanish flu, which, by the way, it actually started in Kansas. The only reason they call it the Spanish flu is because the Spanish newspapers were the only ones who were reporting on it because we didn't want anybody to frickin' report on it. But it started in Kansas. That's the last time we've had something this scary happen. And, you know, this powerful. SARS and MERS, swine flu, those were all very bad. They didn't really impact here as much. They impacted more. Swine flu was Mexico. MERS and SARS were other places, I believe. I don't remember, somewhere in Asia. But, like, this is a terrible situation that we're in. And we were caught totally off guard. We were not prepared, and this should make people rethink our priorities quite a bit and how we approach these things, what we do with our tax money, you know, what we do with our budget, because obviously our priorities are all out of whack, and it's being exposed in such a clear, drastic way right now that it should piss everybody out there off. The fact that if you start feeling symptoms, you don't know, like, hey, should I go to the hospital? The fact that that's a question... The fact that you're like, they won't have enough beds, they won't be able to treat me, what are they going to do for me? That's indicative of a third world country. That's not indicative of what's supposed to be a developed country. So, that's your update on the coronavirus. Again, the numbers are way higher than they're letting on. Way higher than they're letting on. Because we have a lack of tests and we don't know. But this virus is currently ripping through the country. So I mean it when I say stay in as much as possible, as much as humanly possible. And if you think, oh, well, you know, I have to go to work, very soon you might not have to. At least for 3 weeks, probably way longer than that. Because the other thing is experts predict this could last until spring of 2021. Again, we have no developed immunity to it. So it's not just going to go away. Experts say it's not just going to go away this spring. It's going to keep spreading. So it might last until spring of 2021. So we're in uncharted waters now, and we're all trying to deal with it on a day-by-day basis. But I will keep you updated as much as possible on this. In the next show, I'll have another breakdown with an update in the numbers. But everybody just stay safe out there as much as possible. Try not to go out that much. Stay in and, get more acquainted with, I should say, YouTube, Xbox, and whatever activities keep you safe.